You are welcome to today's segment, sir.
Thank you.
You may have your seat. You are all welcome to Graceland Diabetes Foundation and international diabetes educators, reaching out to people in United Kingdom, Africa and the world at large. In our previous episode, we talked about risk factors for type 2 diabetes. In today's episode, we shall be discussing on obesity, complications and prevention. Our instructor for today is Mr. Joseph, an international coordinator, Graceland Diabetes Foundation. You are welcome, sir.
Thank you. I am pleased to be here today.
Go ahead, sir.
In continuation of our topic on diabetes, we shall be discussing on obesity, its complications and prevention.
What is obesity?
Obesity is a complex disease involving an excessive amount of body fat. It is a medical problem that increases your risk of other diseases and health problems, such as heart disease, diabetes, high blood pressure and certain cancers.
It's alarming that obesity is on the increase. Why is this so?
There are many reasons why some people have difficulty avoiding obesity. Usually, obesity results from a combination of inherited factors, combined with the environment, personal diet and exercise choices.
Does that mean there is no hope?
There is hope. The good news is that even modest weight loss can improve or prevent the health problems associated with obesity.
Okay.
Yes. Dietary changes, increased physical activity and behavior changes can help you lose weight. Prescription medications and weight loss procedures are additional options for treating obesity.
How do one know he or she is obese?
Obesity is diagnosed when your body mass index, BMI, is 30 or higher.
How do one know this?
To determine your body mass index, divide your weight in pounds by your height in inches squared and multiply by 703. Or divide your weight in kilograms by your height in meters squared.
Is there any complication associated with obesity?
People with obesity are more likely to develop a number of potentially serious health problems, including heart disease and strokes. Obesity makes you more likely to have high blood pressure and abnormal cholesterol levels, which are risk factors for heart disease and strokes. Type 2 diabetes. Obesity can affect the way your body uses insulin to control blood sugar levels. Certain cancers. Obesity may increase your risk of cancer of the uterus, cervix, endometrium, ovary, breast, colon, rectum, esophagus, liver, gallbladder, pancreas, kidney and prostate. Digestive problems. Obesity increases the likelihood that you will develop heartburn, gallbladder disease and liver problems. Gynecological and sexual problems. Obesity may cause infertility and irregular periods in women. Obesity also can cause erectile dysfunction in men. Sleep apnea. People with obesity are more likely to have sleep apnea, a potentially serious disorder, in which breathing repeatedly stops and starts during sleep. Osteoarthritis. Obesity increases the stress placed on weight-bearing joints, in addition to promoting inflammation within the body. These factors may lead to complications such as osteoarthritis. Quality of life. Obesity can diminish your overall quality of life. You may not be able to do things you used to do, such as participating in enjoyable activities. You may avoid public places. People with obesity may even encounter discrimination.
Apart from the above-mentioned issues that affect one's quality of life if obese, are there others?
Other weight-related issues that may affect your quality of life include depression, disability, sexual problems, shame and guilt, social isolation, and lower work achievement.
Since obesity is becoming a common problem, how then can one prevent it?
Whether you're at risk of obesity, currently overweight or at a healthy weight, you can take steps to prevent unhealthy weight gain and related health problems.
Nice explanation, but why is preventing obesity so difficult?
It's not actually a difficult task. Not surprisingly, the steps to prevent weight gain are the same as the steps to lose weight: daily exercise, a healthy diet, and a long-term commitment to watch what you eat and drink.
How often should one participate in exercise?
Exercise regularly.
Explain please.
You need to get 150 to 300 minutes of moderate intensity activity a week to prevent weight gain. Moderately intense physical activities include fast walking and swimming.
This is insightful. Yes, it's insightful.
Thank you. Also, follow a healthy eating plan. Focus on low-calorie, nutrient-dense foods, such as fruits, vegetables and whole grains.
Throw more lights please.
Avoid saturated fat, and limit sweets and alcohol.
Alright. So what type of food do you recommend?
Eat 3 regular meals a day with limited snacking. You can still enjoy small amounts of high-fat, high-calorie foods as an infrequent treat. Just be sure to choose foods that promote a healthy weight and good health most of the time. Know and avoid the food traps that cause you to eat more.
How do one ensure a follow-up on his or her feeding habits?
Identify situations that trigger out-of-control eating. Try keeping a journal and write down what you eat, how much you eat, when you eat, how you're feeling, and how hungry you are. After a while, you should see patterns emerge.
Shouldn't one plan ahead to keep track of eating patterns?
You can plan ahead and develop strategies for handling these types of situations and stay in control of your eating behaviors.
How often should one check his or her weight?
Monitor your weight regularly. People who weigh themselves at least once a week are more successful in keeping off excess pounds. Monitoring your weight can tell you whether your efforts are working and can help you detect small weight gains before they become big problems. Let me add this. Be consistent in your eating and exercise patterns.
Can you explain this please?
Oh yes. It means sticking to your healthy weight plan during the week, on the weekends, and amidst vacation and holidays as much as possible, increases your chances of long-term success. In conclusion, it's safe to say, dietary changes, increased physical activity, and behavior changes can help reduce obesity, which has a great risk factor of leading to diabetes and other health issues.
Wow. I am relieved. I believe others are relieved too. Thank you, sir, for your time.
It's the pleasure of Graceland Diabetes Foundation.
Please stay connected till we meet again.